Sickle cell anemia is a genetic blood disorder characterized by the presence of abnormally shaped, red blood cells. Instead of the typical round shape, these cells are crescent or sickle-shaped due to a mutation in the HBB gene, which affects hemoglobin production. Hemoglobin is the protein in red blood cells that carries oxygen throughout the body. The sickle-shaped cells are rigid and can get stuck in small blood vessels, blocking blood flow and causing pain, known as sickle cell crises. These blockages can also lead to organ damage, increased risk of infection, and chronic anemia, as sickle cells have a shorter lifespan than normal red blood cells. Symptoms of sickle cell anemia include fatigue, pain episodes, swelling in the hands and feet, frequent infections, and delayed growth in children. Treatments focus on managing symptoms and preventing complications, such as pain relief, blood transfusions, and medications to reduce the frequency of sickle cell crises. In some cases, a bone marrow transplant can offer a potential cure, with proper medical care and support. Individuals with sickle cell anemia can manage their condition and lead active lives, although they may face ongoing health challenges.